Hi everyone, I'm Joanne Foland from Opportunity Schools, and we're fortunate today to have Ron Lee from Autism Partnership share some of his thoughts. But for those of you who don't know Ron or his organization, could you tell us a little bit about you and Autism Partnership?
I've been in the field for 35 years, started at UCLA Young Autism Project, had varied experiences including living with children with autism and adults with autism, and currently we have a practice, Autism Partnership. We work with school districts and parents throughout the world, helping them with their children with autism spectrum disorders and helping them in terms of treatment and helping them reach their potential.
And I just happen to know from personal experience that everything you do is research-based and it's absolutely outstanding.
Thank you very much. I mean, at heart, we're researchers. It's what works, what's effective, what has data to show it to be effective.
Well, Asperger's is kind of out there, big. Lots of parents don't know what to do. What kind of advice would you give parents who suspect that maybe their child has Asperger's?
Get in treatment quickly. I think that with Asperger's, the hope is that with time, children will get better, adolescents will get better, and perhaps have a few social groups here and there, and that'll make the difference, and that won't make the difference. They need more intensive work in social skills so they can develop friendships, meaningful friendships, and work on ways to cope with frustration and stress. It needs to be treatment-based. They have tremendous high functioning levels and abilities for potential, but without the treatment, they're not going to reach that potential.
Where do you go as a parent to find out? I mean, there's so many agencies and organizations out there. How do you establish credibility? And
you have to be a careful consumer. These days, there's agencies throughout the world that claim to be experts at treating autism and Asperger's, and often they're just not. They're interested, but they don't have the skill set to be able to treat this population. It's really being careful, going and finding out what have they done. What has their experience been? How long have they had this experience? Are they research-based? And really doing an interview and finding out what it is they do.
They say that intervention for children with autism, the earlier the better, certainly, but sometimes with Asperger's, kids are a little bit older.
Absolutely, and it would be better if they got intervention early too, but it's harder to diagnose. These are children that their cognitive levels or speech levels are normal. It's not until friendships around other children that becomes more apparent, and as frustrations increase, that helps also in terms of the diagnosis. But these children often are not getting diagnosed until they're 7, 8 years of age, and clearly it would be better if they got diagnosed early and treated earlier, but as soon as you possibly can, you need to get these children into treatment.
Well, maybe our next interview we can talk about some specific treatments and suggestions that you have found absolutely do work and are effective with children with autism.
I look forward to it.
Okay,
Thank you, Joanne.